I'm Susie Swithers. I'm a professor of psychological sciences in the College of Health and Human Sciences at Purdue University. Erythritol is what's known as a sugar alcohol. So it's a chemical that's similar to sugar, but it's not the same as sugar. What that means is our bodies don't metabolize it. It tastes sweet to us, but our bodies can't break it down, so we don't actually get energy from it. Manufacturers, food and beverage manufacturers, use erythritol as a substitute for sugar because we can't break it down. So you can make something taste sweet, but have fewer calories if you actually use erythritol instead of sugar. So in the new study, they were looking for factors in the blood that might predict the risk or an increased risk for heart disease or stroke in people who already were being evaluated for these problems. So the population were people who were at risk for heart disease and stroke. And what they did was they looked for factors in the blood that seemed to predict an increased likelihood that those people would have some kind of negative outcome, a heart attack, a stroke. And they discovered that people who had elevated levels of this chemical, erythritol, had an increased risk for those negative outcomes. So higher levels of erythritol predicted an increased chance of experiencing a heart attack or a stroke in the future. The people that they studied who were already at risk had, reasonably high levels of erythritol at a time before erythritol was really prevalent in our diet. So for those people, the erythritol was probably being made by their own bodies. But what's happened now is that we have erythritol in many more food products. So now we have people who might not have been at risk, whose own bodies are not necessarily producing erythritol, but whose bodies are now being exposed to higher levels because they're getting it from their diet. So the risk was demonstrated in people who already had the risks, but the levels that we get from eating or drinking a product that contain erythritol are high enough that even people who don't have those risk factors in the first place could be achieving those if they consume erythritol products regularly.